congregate living situation and you've got to take everybody in the house to the emergency room, that is certainly not something that is anybody's favorite community activity. So by having that opportunity for a physician on the other end of the phone to kind of guide the person through a real-time, telehealth appointment essentially, and kind of walk that person, their caregiver, providers, and team through an appropriate course of action, it really helped a number of folks spend less time waiting in the emergency room. It helped the emergency room physicians be prepared when somebody was going to be coming, because the part of the Station MD pilot was them calling ahead to the physician's office, and then when that visit was over, following up with the person, the caregiver, and team to provide any follow-up necessary, and then certainly reporting all that back to the person's primary care physician. There was a lot of positive feedback with this pilot program, and we were able to create a service which we are calling healthcare assessment, and that is now proposed in our current waiver amendments. It's a service available to folks on level 1, self, and IO waiver, so it's in all 3 of the waivers, and it provides a real-time virtual consultation by a physician, a physician's assistant, or an advanced practice nurse, assisting the individual and their team, caregivers, to understand the person's presenting health symptoms and identify appropriate next steps. If required, there's a clinical transition of care, so we're modeling the program very similar to how things happened in the pilot, and there we're going to reach out to any urgent care or emergency room, and then follow up and aftercare as needed with the person. This is a monthly subscription service, so it is going to be a little bit different than other services that we have stood up previously. You can use, it's a monthly subscription, but you might call once a week, you might call, once a month, maybe a month you don't have any medical issues and you don't call, but it is a monthly subscription. So that's how that will work. At this point, we want to be clear that we're calling it proposed. We're, hoping we get the approval from CMS, and we'll be able to stand this up in July. And there will be certainly a lot more, a few more resources, PowerPoints directed and dedicated, to the healthcare assessment itself once we get a little bit closer to it rolling out.
Question.
Becky?
Do you want me to use a mic?
You probably should use a mic, yes.
Behind me? Thank you. So how... You want to try to push that?
Sounds like it's cool.
Yeah.
Okay. So how is this going to be paid for? Is it coming out of waiver funding? Or?
Yes, yeah, it's a waiver service, and so it'll be in somebody's waiver budget. So when teams sit down and talk about, service planning, does somebody have a need, somebody with some medical issues.
Okay, so currently that's all paid for by our medical Medicaid card, that kind of stuff. So now you're offering a service that's going to maybe reduce our funding. I just don't see how that's a good thing.
It's not a service that everybody needs, so it may or may not be something that people choose if they have something that they feel more comfortable with. Their primary care physician has a very solid, comprehensive, 24/7 hotline, and you feel you get that support and service from them. Of course, this is not in any way to replace your primary care physician. It is an option. Certainly, we've had folks in some rural areas who have found, have found it more difficult to find this kind of support. So this is merely an option for people who may not have another option.
Could we stop using that one just to try it and give her a wireless?
Oh.
Yeah.
Oh, okay. So you think it's me? Okay, there we go.
So
Okay, so it's this, sorry.
I do want to add to that too. Becky, I think the key to this is, so you would have an option, as Joelyn said, you would have an option of urgent care or anything under your state plan These providers are, I think, that plus some as far as being, you know, trained in DD. So again, yes, you do not have to choose to put this on, you know, on your waiver services. So we're looking at this as kind of a more specialized, urgent, you know, telehealth service. But it is a choice, not required.
And you don't know how much it would reduce the budget by yet?
The proposed rate is $34.50 a month.
You just said for more specialized care. Could it be, like I have to take my daughter maybe once or twice a year to an after-hours clinic, to Rapid Care, or the CVS Minute Clinic?
You knew I was coming with this mic.
You were screwing up the mics. I thought they'll use my laptop.
They fired me.
I mean, would this be a viable option that I could have telehealth and maybe have a prescription phoned in for my daughter rather than having to take her to an after-hours clinic or a weekend, you know, CVS Minute Clinic?
Yeah, it cannot.
Or is that not what this is for?
It cannot be your routine physician. So depending on what kind of prescription that is. If you're talking.
Pink eye?
Yes.
Okay.
Yes, ma'am.
I'm in.
She says I'm in.
Yeah, and just with any service, I mean, as teams sit down and plan for all of the things and your needs. So it is very individualized, and again, not every waiver service is for every person.
Yeah, what it can't be is like, I'm gonna get my routine diabetes medication from, like, it can't be that.
So what we found it useful during the pilot project was for people that needed to, like acute care that needed to take Ativan or a medication to calm them down if they had to do an emergency, so that way you didn't have to administer those types of medication to call in about a rash or something different like that. It worked really, really well for that, for those people that needed that calming med.
We did hear some of that as far, when you talk about rash, like a consult. I don't know if any of you ever found with your own children, like, what in the world is this rash? It is the strangest thing I've ever seen. So we did hear some of those stories as well. You know, just some professional eyes on something that just seems strange to you. We did hear some of those stories as well.
Okay, the next thing we're going to talk about are something also proposed to start July of 2024, and these are outcome-based payments relative to improving the quality for employment for folks. I will say there are going to be a number of additional trainings on this issue, because this is certainly something that looks very different from what we have done before. And there will be, at the end of the presentation, there are 3 upcoming dates where there will be probably an hour and a half dedicated to just talking about the sort of employment packages that are under the waiver and the options, and then in much greater detail on the outcome-based payments. So there are going to be 2 opportunities for providers to receive a supplemental payment in addition to their fee for service. So right now, providers, you know, provide a service, they bill for that service. These are 2 opportunities for those providers to get a supplemental payment, or a, you know, just sort of an enhanced payment for meeting certain benchmarks. So the first of those is under the career planning service in job development. Before I start, I will preface this by saying nothing is supposed to change relative to how we help folks get jobs, relative to going through OOD first, which is the Ohio Opportunities for Ohioans with Disabilities. Sorry, I always missed those first 2 O's up. So our expectation certainly is still that folks use the processes that we have been using. And there is going to be a very hearty employment planning training in July by the Community Life Engagement team. So stay tuned just for folks for that information as well. So the first option or opportunity for someone to receive a provider to receive a supplemental payment is following the person's achievement of getting a competitive integrated employment. So that is somebody who the provider under job development has helped them secure a job. The second opportunity for a payment is that let me see, I didn't put all that detail in there. The second opportunity would be if that job is at least $12 an hour and at least 30 hours a week. So there are two opportunities under job development for a provider to receive a payment. And then under individual employment service, which is generally your follow-along service, the provider has an opportunity to receive 2 payments for helping the person maintain that job. So under the name of job retention. So 90 days after the service individual employment starts, the provider is eligible for a payment, and then 180 days after the person starts receiving IES service, that provider is going to have the opportunity for a supplemental payment. So these are 2 opportunities to help build the quality. There's an employment quality program pilot kind of going on now outside. It would help with the securing of some of that information, usually, by a pay stub or 2, kind of identifying that the person has indeed secured the job and maintained it for that 90 to 180 days. And this is going to be an option in the IO level 1 and self waivers as well. When an individual selects job development or IES support or individual employment support as their service, the team will certainly talk about the option that the provider may be able to receive a supplemental payment. So the team can sort of talk about all of those options when the person is lining up their service and their budget. Before I go into resources, I will wholeheartedly apologize. I forgot the slides on specialized medical and wanted to just address a couple of the updates that are being made to the specialized medical service and rule. We have made a couple updates to the rule, which specialized medical will now also include repair and maintenance of a previously approved item, which is within its useful life, as well as replacement of a previously approved item that is within its useful life. And we have gone on to define useful life, which is, I'm sure, everybody's next question, which really means the amount of time during which an item is expected to be in service, sort of as defined by the manufacturer. So these were 2 things that had not been in our rule before, which we think will certainly help folks. The $10,000 per item cap is still in play, and we are, want people to know that we are working very closely with ODM to assure that things that are required and should be covered under Medicaid state plan are indeed covered. And Medicaid is very clear with us that only they can determine what is and is not covered. So we are working very closely with some folks at ODM and then working with county boards so that we make sure that what we're submitting and things that people are absolutely entitled to are getting approved. And then, of course, working through what happens when something doesn't get approved and we put it through the specialized medical service. So, whoops.
Sorry.
Oh no, you're fine.
So I have a question. As far as you were saying about the follow-along services, now currently OOD, here's your mic.
Yeah, it seems like the mics are on a delay. Like once you hit it, you just have to wait a minute. And then,
Okay, so as far as I know you guys are adding like the 90 to 180 days, is that going to eliminate then OOD doing the 90 days, or is that just going to be in addition?
absolutely not. So we are not changing. If somebody gets their job through OOD, then they're going to get their job through OOD. If they go through 90 days and then don't need any follow-along support, then things will end there. If at that 90-day mark that person needs additional IES service, which is the individual employment support, that 90 and 180 day clock will start when that person gets authorized for the waiver service. So this is not a supplemental payment for OOD job development. This is or OOD follow along. This is for the waiver service.
So this would probably be like, so if they chose like CLW or TWI or something like that, are you saying that's for them to continue to provide the job coaching then in addition?
I don't know who those people are.
Oh, sorry.
I don't know those initiatives. But if you've closed out of OOD, so this supplemental payment is not for OOD providers. So once you're done with OOD and you still need individual employment support, follow along, traditionally what we've called it, and you want a waiver provider to do that, this supplemental payment will then be an option for that waiver provider going forward. And again, May 24th, June 5th, June 24th, there will be lots and lots more information on this topic, at least an hour, hour and a half each one. So that should help, clear up, a lot of questions, because I know this is brand new for folks.
The $10,000 that you said, is that for lifetime of the waiver or is that per year?
Per item. So for specialized medical equipment, it's $10,000 per item.
Per item.
And then that, of course, needs to fall within your budget, however that works, so. And while she's walking over with the mic and it's turning on and taking its time, anytime anybody has questions, please, waiver policy TA@dodd.ohio.gov. I have a small team and we answer, try to work those questions that come into the mailbox. Certainly sit down with county boards and providers when we need to. And then the employment first at dodd.ohio.gov. If you have some specific questions about the outcome-based payments, that's part of the community life engagement team. And if you want to direct some questions specifically about how that'll all work, I would direct you there. Or if it comes into waiver policy TA, we'll pull those folks in.
So I know there's still a lot of work to be done with the Blueprint Group and different things with trying to iron some of these things out through the changes in the adult day services and vocab. But I don't know if you could touch base a little bit on the time limitations on vocab, as we're only a couple of months away right now, and SSAs are redoing plans and providers are doing plans, that maybe everybody could understand that there's some of those things being looked at. So we're kind of aware of going forward about what needs to be done with that time limits.
So there's nothing changing in July of 2024 with those current services, with vocab or adult day support. Those services are continuing as they are. There are certainly some things being looked at for future, because anything that we would need to change has to go through a waiver amendment. So typically that's when because they have to be approved by CMS. So that's why we're generally on a sort of every 6-month calendar, because we, made all the changes we did for January. Now we're working on these July things. So only what really we've sort of hit on today are the big changes in the waivers for July of 2024.
Okay, so then we don't need to worry about the vocab time limiting right now and the changing of the smaller group.
Are you referencing like BEST? Or?
Yeah.
Okay. Yes, we are still discussing BEST and the time limits, but that is not scheduled for implementation this July.
Okay, thank you.
Yeah, usually things are far enough ahead. You'll have an idea of as we're moving, because we generally have to submit everything to CMS 90 days ahead. So people will get plenty of notice when we're making other additional large changes.
I do think, in all fairness, everyone in the field needs to start preparing for the fact that vocational habilitation, as we all know it, is going to be transitioning.
Yep.
So I think everyone needs to keep that in their head and be thinking about new business models, and we've been talking about that for years. So that needs to continue, but there is not a drop dead date of implementation, certainly not for this July.
And thank you for saying that, because it's kind of hard for us as providers when
Yes.
we're trying, we've been talking about this for 2 years through the Blueprint Group, and
Yep.
we're trying to talk with parents and guardians and say, listen, they can't continue to stay on VOCAP their whole life and
Yes.
receive a paycheck. There has to be
Yes.
some growth, and there has to be some different things looked at. So I think that sooner that information can get out, I think the easier maybe the transition will be, because for some parents and guardians, it looks like, what do you mean my son can't continue to do X, Y, and Z and receive a paycheck through the day service provider?
Well, the reality is the service is pre-vocational and it is a time-limited service.
And that
Correct.
thing
So
that we all got in
we as
mail.
a state
Okay.
have to get there
I didn't know
somehow.
half of them.
So
Thank you.
you're very welcome.
Any additional questions on the changes? And like I said, very shortly, we will be getting out a number of our one-pagers, which are just sort of some quick, easy facts on the updates and changes that'll be happening in July. There will also be some recorded webinars that'll be released, as well as the PowerPoint presentations. And again, waiver policy, TA@dodd.ohio.gov. Call me anytime, or email me anytime. We're happy to answer all of your questions. Right.
Advertisement.
Hello. I was going to try to not ask any questions today, but I do have a question because you brought up the vocab. We were talking about the vocab. I have a parent who's probably 35-year-old son. We're having their ISP meeting soon, and this is such a heartbreak for her that it is ending. And every time I talk to her, she asks if I have a timeline. So is there maybe something I could tell her?
So when you say it is ending,
The vocab, and that we'll be leading into ADS.
okay, so there will still be a pre-vocational service of some type.
Okay,
It is the issue that that her son, that you said is 35,
about.
just is not interested in any kind of employment of any sort.
I believe he's, I think he would be a strong one-on-one to be employed in the community.
It may be that we need to just have a conversation, because I think our intent is to have, several options for people. I don't think our
Okay.
intent is just to end. I think a lot of this is the messaging, right? I think we need to message it well as a state to people. And our message is not that everyone goes into ADS.
Okay.
Our message is that we're going to have several options for people. We intend to really build up our group employment service, which is going to happen early next year, hopefully. And so I think we really have some good, solid plans for Ohio that people will have, some good options. And so, that's our hope. So it's not just we're ending it.
Okay.
So we're certainly happy to.
Are there any websites or anything that I could direct her to so she can, she really investigates a lot of things on her own.
Sure.
And researches. Is there anywhere I can?
I'm not sure why this is doing that.
That's Mike too.
Okay, that's your mic. Can we change her mic?
Yeah, it's okay.
Why don't you touch base with us and we'll get your information. I'm not sure what we have that's really kind of public yet, but what we could give to just reassure that things aren't going to end abruptly.
Okay, anything else? Thank you very much. Appreciate being here, and as Nyoka said, we're sort of in the back corner, so if anybody has questions in between or email.
Okay, now I apologize for all this crackling right out of our hands. Well, we're working on it, let's put it that way. But I just wanted to comment, I was probably a little flustered this morning. Paul Iden, who has been our wonderful IT assist all these years, became very ill this morning and was taken to the hospital. So if we could please keep him in prayer. And I really want to thank his friend Rob, who stepped up, and Dave Lewis from the ARC, who has a strong background. I'm lucky I can even talk in this microphone, so I'm very blessed that they were available to step up and help us. But our next speakers, of course, are Gary Tonks and Dave Lewis from the ARC of Ohio. They're going to be talking about participant-directed goods and services, self-directed transportation, and anything else that comes up. So if you have any questions, we have some folks located in the back there with a microphone so that we can all hear the question. So if you can just raise your hand and give us a couple seconds to get to you, we'd like your question to be heard by everyone. So Gary and David, welcome.
Thank you. Morning. It's always a pleasure. Dave and I are also best friends, so when we interrupt each other and smack each other, it's all with love. So
I'm just going to turn his mic off at some point.
Yes.
So
we thought we'd talk a little bit first about who we are, who the ARC is. If you've ever heard of Gladys Morrison, if you've ever heard of Robert Bycroft, if you've ever heard of Leonard Kurtz, that's who we are as well. We've been around since 1950. I always say we're the grandmother of the disability movement, and you don't mess with grandma. That's our motto. When we go to our national convention, or we have new people come on board, and they say, well, what authority do I have as an advocate? And my response to our new staff is to say, we're the ARC, damn it. So Dave's going to tell you about a little bit of our history.
Sure. So like Gary said, been around since 1950. Started by parents, mainly moms, like all those moms, who wanted something different for their loved ones, right? So when you had a child with a disability, you went towards the school system. They said, take your kid home. We don't have anything for her. So they started those what are called sheltered workshops in schools, which then turned into county boards in 1967.
So we've been around a long time. I'm going to go around here so I can see my notes. This is my 50th year with the ARC. I know I don't look that old, but that was a joke. I do look that old. It's been 50 years working in Pennsylvania, Alabama, California, and I've been the president and CEO of the ARC of Ohio for going on 28 years. I've lost count. So it's been a long time. What I want you all to know is that everything we talk about today is going to change in 6 months. So the parents that are really worried about what's going to happen to day services, what's going to happen to residential services, come back in 6 months. And we'll, often in Columbus, I feel like I'm in that Groundhog Day movie because I've been here before. We've talked about this before. I've been on the Adult Day Service Committee for a decade. I just delegated it to another one of our staff. We in Ohio have just about the only department head, cabinet member of the governor that exists in the country. That's a wonderful thing, except that every time a governor changes, we have the risk of changing directors, which changes sometimes the direction of DD services. So the superintendents in the room, if you see them, I have a natural tremor, but if you see them trembling, it's because I thought we were going over here. Okay, now we're going over here. They're all good people, but we're in a political system that is different than the rest of the world. I grew up in West Middlesex, just across the border. People told me not to get too close to Dave when I talk, because I tend to smack, not on purpose. I grew up in West Middlesex. Pennsylvania has an entirely different system. West Virginia has a different system. Indiana, all of our border states, the rest of the country, you pay your local taxes, your state taxes, they go to the state capital, and the money is evenly distributed. And I love to tell this history lesson because you have to follow the money to understand where we're at, where we're going. We're just about the only state in the union that when you go to the JFS office, those people work for the county commissioners. They don't work for the state of Ohio. So we have 88 counties interpreting state and federal law, and what you hear in Portage is not always what you hear in Columbiana County, even though all the rules are the same. I sit in the gallery at the State House, and counties will sometimes say, we couldn't afford to upgrade our software, so our software in our county doesn't talk to the software at the state level. If you're not understanding, sometimes that's it. Our county system evolved from a county school system. The history, Gladys Morrison started this county school in Trumbull County. And in 1967, that evolved into the County Board of Developmental Disabilities in Trumbull. Same with Mahoning, same with Portage, same with Columbiana County. And those parents adopted our school funding formula. Those of you who have been around for the last 30 years know our school funding formula was declared unconstitutional. But there is no entitlement to county services. So we have a different tax base in each of our counties, like we have a different tax base in each of our school districts. And therefore, things are different in every county. But what we're talking about today is primarily Medicaid and waivers. Medicaid and waivers are federal state partnerships, not federal county partnerships. And this sounds terrible, back at the turn of the century, when we were redesigning our waiver system, we had to agree with the federal government that pays 60% of the cost of Medicaid and waivers that we would operate as the state of Ohio, not as a county system. Are you following me? So we've got a county funding system that's matched with a federal law and a federal program called Medicaid and home and community-based waivers. We do a really pretty good job. My last assignment was with the Arc of California. They had an entitlement to services, so it was illegal to be on a waiting list, but they had a finite budget. So every time someone got into the system, everyone else got a little less. Our system, if you're in, it might be hard to find a provider, but you've got services available. And virtually every county will at least use local dollars to fund people when they can. But you need to know that's our system. We sit at the table in a modernization program that's going on right now. So in the next, and Joelyn and Nyoka talked about what's happening in July. In the next couple years, our system is going to be redesigned again. So those of you who are on the IO waiver, and you're concerned about the acuity assessment for day services, and the developmental disability profile for the funding you get at home, those things will change. Those things may not even exist. Something else may exist in their place. If you're on the level 1 or the self waiver in the next couple years, maybe there'll be only one waiver to replace those 2 waivers. The promise is no one will lose any services, but you'll see that the state on January 1st increased the budgets. So we're in a process right now in the next couple of years that things are going to be majorly changing. You need to know that the ARC is at the table. We're at the table with good people like Nyoka and Joelyn and Lindsay, who's coming later, and Jesse this afternoon. You're represented at the table, but contact us. We have a Facebook page, connect through Facebook. We have a newsletter that goes out every Friday morning. Ask to be on the newsletter list. It's well over 18,000 people now receiving our newsletter. At least a third of them are SSAs. We are not an exclusive organization. Belong. stay involved, because within 6 months, things will change again and you've got to stay current. Okay, so let's get into self-directed services. We're primarily going to talk about participant-directed goods and services and self-directed transportation. But we want to begin with, so who's the participant? And who gets to decide what's going to happen in my life? Well, first of all, if I'm an adult and a local probate judge has not declared me incompetent, it's me. And even if I have a guardian, guardianship law in Ohio says the guardian has to listen to me. They make the ultimate decision, but their guardianship is at risk if they're not listening to my preferences. And in those cases, the probate judge is what's called the superior guardian. So if you have a case where I've been declared incompetent, I have a legal guardian, but my guardian is really not listening to my preferences, I have the option of going to the court, who does get the ultimate say. All right? So it's me, it's my legal guardian, but not always all guardians. If I'm a guardian, if I have a guardian of an estate, but I don't have the other kind of guardian, my guardian of estate can't decide where I live or the decisions in the ISP. So you have to be careful of who's the guardian. If I'm under 18, my parent is automatically the decision maker in Ohio, okay? And we put in your little packet something we helped develop legally 15 years ago. It's an authorized representative. It does not have to be on this form. But let's just say I'm 19, I'm an adult, I don't have a guardian, but I hate going to ISP meetings. This form was developed by the Department of Developmental Disabilities, but it could simply be a piece of paper that says, Gary is selecting his dad as his authorized representative to sit in that ISP meeting. This only works in DD land. This is not something that would work in an IEP, for example, if I'm 19 or 20 and still in school. It says that I've selected Dad to be my representative, or I've selected David to be my authorized representative. What's different about this than guardianship is I can fire my dad at any time. I'm still a competent adult, and I can fire him and replace him at any time. It doesn't have to be notarized, but I've got to sign it, David or my dad has to sign it, and they're my representative. It's backed up by state law, and it's existed for 15 years. It's available, it's an easy way without guardianship. What we found 15 years ago is there were too many people being declared incompetent that really kind of knew what they wanted to do in their life.
I think there's a difference too when you talk about authorized rep, and then people get that mixed up with representative payee and the social or power of attorney. There's lots of different things out there, so just be clear on that. It's a different thing.
Right. So there's also an authorized representative form in Medicaid land. It used to be, if I wanted to do process hearing, I just called the number, Medicaid assigned a hearing officer. Now, if you have a hearing through Medicaid, they're going to ask you what authority you have to call for that due process hearing. We didn't include it in your packet, but that Medicaid has an official form where someone can assign you as their representative. Things are changing. Any questions on who can self-direct? Okay. It seemed pretty self-explanatory, but a lot of times I'll get calls from an independent provider who said, my hours were cut. I'm filing a due process hearing. Nah, you don't have any right to do that. You're the provider. I got a call from an agency provider in southern Ohio the other day saying, hours were cut for this person. I'm going to be their advocate and I'm going to file for a due process hearing. You're the CEO of an agency. I don't know. You don't have any rights. If a provider is benefiting financially by asking for more hours, you're going to be looked on differently in a hearing. The hearing officers are pretty black and white, and are you doing it because your hours are cut, or are you asking for an appeal because the individual's hours were cut and his health and safety is at risk? You know, so providers in the room, work with your families. They're the ones that have the rights. But a mother or a father of a 19-year-old who is not the guardian has no more rights than my mother and father had over me at 19. Does that make sense? Those are some of the things we deal with on a regular basis. Okay? All right. So let's talk about everyone's participant-directed goods and services. It's been around for years. It existed at the beginning in the self-waiver. As of a couple years ago, it also exists in the level 1 waiver. But the difference is, in the self-waiver, I could use all of my budget to purchase participant-directed goods and services. In the level 1 waiver, there's a cap of $2,500 a year. It is not available in the IO waiver. It's a service category. So let's talk about why it was created. Follow the money. The example I give to most parents is if you have a kid with a physical challenge, chances are you've encountered those great big exercise balls. If I buy a large exercise ball through a medical supply company, it's going to cost you $250.
Right.
And you can go to Walmart for $50 and get exactly the same thing. Participant-directed services allows me to go to Walmart and get the $50 ball. If in my ISP, I can prove that it's beneficial on several layers to get it at Walmart. But I can't go buy it myself. That's the key. With participant-directed goods and services, the state created a third party, a financial management service that we use. It's called GT Independence. Have you ever heard of GT Independence? They don't get money from your waiver. They have a separate contract with the state of Ohio to pay Walmart for the ball. So you have to, in your ISP, say, we need an exercise ball. It's not available through my Medicaid card. Now, it might be. I'm just using this as an example. It's a service not available from my Medicaid card. Walmart is not a specialized DD provider, and your SSA and your team approves the purchase of that ball.
And it meets one of those needs on the list.
Right.
Just to be clear, we talk a lot in our system about wants and needs, right? So it's about needs and how does it help support that individual.
So the requirements are it addresses a need clearly through an assessment. It is something that helps you directly and is not something purchased for people that support you. So my provider doesn't need the ball, I need the ball. It's something I need to be healthy and safe. And it must do at least one of these things. Decrease my need for waiver service, advance my participation in the community, help me be safe in my home, offer me more independence, improve my cognitive, social, or behavioral function, and help me develop personal, social, or physical skills. It's got to be one of those things. So when you ask for the ball, and again, ball might not be a good example because I might be able to get that through my Medicaid card, I have to be able to prove at least one of those things. As of late last year, county boards are advised if that ball costs more than $500, the county board has to have a committee locally that determines whether it can be bought somewhere else or whether it really meets these things. But the county has the discretion to have that committee to supervise and observe and authorize any purchase under participant-directed goods and services. So the guidance is just have one for 500 and more. But if your county wants to have it for all purchases, that's up to them. Now, from a civil rights and a parent perspective, how long should that take? It should not take a year. It should not take 6 months. But we know of cases where it's taking months to get the ball approval that I needed yesterday. So that's something we're all working on. But you also, in participant-directed goods and services, have to determine whether another billing code within the waiver will be able to buy it. Okay? A general rule with participant-directed goods and services is if the business, if their primary customer is a person with a disability, you can't use participant-directed goods and services. If the primary customer of the business does not have a disability, then you can. So I'll give you a real example. We're working with a transportation provider in Northeast Ohio, but not one of the counties represented here, that advertises itself on its website that it was created to support people with developmental disabilities with transportation other than transportation, homemaker personal care transportation, and non-medical transportation. And they're not certified. What several counties, because it's a really good provider, had said, oh, we're going to use participant-directed goods and services. This company's really good. It was founded by a special educator. We feel comfortable. They can't use participant-directed goods and services. They're going to have to become certified as a developmental disability provider or become something else. You have to, so, am I making sense?
I think so.
Okay. So the other thing is camp.
Well, I guess that would be more of a question for the audience.
Yes, I guess so. So have you all heard of the Rotary Camp? It's outside of Akron. It's got a wonderful reputation. But they're not a certified developmental disability camp. But they only serve people with developmental disabilities. A number of people want to go to the Rotary Camp, but they're not certified. Therefore, your waiver cannot be used to pay for camp at the Rotary Camp. But the Boy Scout camp could, the tuition or registration of Boy Scout camp could, and then the burden of trusting the Boy Scouts falls on the parent. So the understanding of the certification, Kathy's program is certified. And we know that that program has met all the requirements of being certified, which means all the staff are at least 18, all the staff have CPR first aid, all the staff have had criminal background checks, all the staff have been trained. We don't know that about non-certified staff. So you can theoretically trust the state of Ohio that they have trusted that program. With the Boy Scouts or with any campground, the family has to trust the campground. And you don't know that they've had background checks. You don't know that they've had training. You don't know that they know CPR. Is that making sense? So you can use participant-directed goods and services to purchase the non-certified camp, but you can't use participant-directed goods and services to purchase a certified camp, but you could use a billing code called community respite. You just have to follow the billing codes. Any questions? Okay.
You guys are quiet today.
You really are.
There's
You know,
lots of questions.
The last conference we had a cocktail hour, and people were much more engaged.
There you go. That's what it was.
We found that our legislators don't come for coffee and donuts anymore, but we served coffee and hors d'oeuvres, and the room was packed. So I think Bloody Mary bar next time, Jennifer, you know, that or mimosas and Bloody Marys. That would be really good. Okay.
Before he goes off on a tangent about alcohol, I do want to just kind of remind people as we talk about services. I think for all of us, what we're trying to achieve is create flexibility within our system. So whether that's billing codes, different options, because it's about the continuity of care for people we're serving. And in Ohio, we do have pretty good funding. Now we just have to be able to tap into that and use that stuff wisely. Because 60 cents from the dollar comes from the feds, 40 from the county boards, local levies, not always, sometimes there's state-funded waivers. Remember when we're talking about waiver services, a waiver is a payer of last resort. So when someone has like private insurance or their Medicaid card, there's a process there, right? So waivers are great, it's a funding stream that follows you within Ohio, but just keep that in mind. It doesn't mean we always get everything that we perceive we want.
Right. And there are some things that cannot be purchased. Right. Like you can't buy a swimming pool. Right. People say, well, what about a fence? My kid runs, I need a fence. Maybe, but if you want a fence and your team agrees you need a fence, the state of Ohio has to approve the fence. Or if I need there's a cap in the waivers of $10,000 for home modifications. If I don't use the home modification billing code, I want to use participant directed goods and services. If what you need, if that ramp and fixing the bathroom costs more than $10,000, you also have to get state approval for that.
I think some of those things are tricky because when you start talking about it benefiting the whole household, that's where it gets a little complicated, right? So we've got to stay focused on the needs of the person. And there are ways that we can talk about those in the meetings, but again, when you talk about, well, I need AC for the whole house, or I need this home mod, what do we need that for? Is it for the person, and does it benefit the whole family at the same time?
Right, so there's a term in there called general utility.
Yes.
The waivers cannot buy anything for general utility. Well, what's that mean? Basically, is it benefiting more than just the person on the waiver? So I'm working with an older family right now in this one's Southwest Ohio, that believe they need a fence for their son. But dad is also the provider. So the county is saying, why do you need a fence? Well, they're saying, you're being paid to supervise your son. So why do you need a fence? And his argument is, my son does have alone time in his plan, and for him, the best use of alone time is in the backyard, because he wants, like any person, to be away from his parents from time to time, and we need a fence. The county came back then and said, well, we believe this is for general utility. And he said, my wife and I are in our 70s. I don't think we need a fence. So it goes like that. We have a young woman in the central Ohio County that uses a wheelchair. Their house is in the country. They have a gravel driveway, and she's still in school. She needs to get to the school bus, and she can't get to the school bus on the gravel driveway. So the parents asked that the county use the waiver to pave their driveway, and the county rightfully said, we can't pave the driveway. But the county eventually approved a little, sounds weird, a walkway for her wheelchair so that she can get to the bus. The walkway was specific for the person with a disability. So when you're expressing a need, it has to be a need for the person on the waiver, and you have to be careful that it doesn't benefit the entire family. Dave used an example of air conditioning. My kid's got asthma. They need air purifiers. They need an air conditioner. We'll do that in the bedroom. And yeah, I really want to go in the kitchen sometimes too. But a waiver won't pay for air conditioning for the whole house. You know, people have had, maybe my son's in a wheelchair and we've got 1970s shag carpeting. It's not gonna put flooring in the entire house. So there are restrictions. The hardest concept for me always and my mom was on a passport waiver for a while, is that waivers and Medicaid are welfare. They are what they are. So whatever you think about people who accept welfare, not our county system, not the DD system, but the greater system thinks of us as on welfare. It is Medicaid is the Obamacare of the 1960s for poor people. And people with disabilities are poor. So Medicaid is for poor people and for people that are age, blind, or disabled, and also poor. So that $2,000 cap that we're trying to get, that's the poverty level. It's the same cap for other people. And disability under Medicaid is my inability to work and bring in gainful employment, be gainfully employed. You got to keep them in those bigger concepts in your mind as to, well, why are they treating me that way? You know, JFS staff have been trained that we're faking it to get our kids welfare. That's part of the training, because people testified in Washington that we're faking it, like you fake your kid had Down syndrome or autism or cerebral palsy. But that's the training behind the system. Okay, all right. Yes, please.
I have to wait for the microphone.
Yeah. I would try to come through there, but I think she's almost there.
Can you break out costs for services, for modifications, like very specifically that walkway that they poured?
Right.
Let's say that cost $5,000, but to do the whole driveway would have been $25,000. Can the family incorporate, I'll kick in the 20 if, like, does that happen? Or with air conditioning, if it costs $2,000 to put a unit in the bedroom and $10,000 to do the house, can I kick in $8,000, ask the waiver to kick in $2,000, and then the person would have access to the whole house instead of like 2 rooms?
Right, so the advocate in us, right, says, well, if we talk about the AC thing, right, and we say, well, we're going to pay for that, the waiver's going to pay for an AC unit in the bedroom, but doesn't he have a right to be in other areas of the house? So it does get a little tricky. Nyoka, you look like you're ready to say something, so.
Well, we get asked this question a lot, right, when projects are submitted. And so I would advocate, because I'm one of the reasons people can even get a walkway.
Yes.
I would advocate that the person should get as much as they can that is actually medically necessary, because medical necessity still applies to these services.
Right, yeah.
So, but once that's established, the family cannot supplement that project.
Okay.
However, if we can work it out, the family could do an entirely separate project, but it would have to be entirely separate, and we would meet.
Right, I think it's mic 2, so I'm going to give you a new one. Sorry.
Yeah.
So what?
And I do have to say, I love this woman, because she and I, if I have a challenge that we need to get something for a family, she helps us figure out how to get it done.
Right.
So I could work with the contractor on the side?
Entirely separate. And please leave everyone out of that, county board, everybody out of that, seriously. Because, I mean, these are things that could get us all in trouble.
Right.
So you would need to, do that entirely separately. And we do this with, the family would like a special vanity, the family would like something that's not medically necessary. That needs to be done entirely separate from the entire project, right? Something that we're not part of. So if that's the case, then you would do that entirely separately from the whole thing.
And also, don't make the mistake of going and getting something done and then trying to come back and have Medicaid pay for it after the fact.
And we're seeing a lot of that too, right? And then families are being very insistent with county boards that, this has to go through, and,
The process can be very frustrating, right? It can take time, and I think that's why families lose their patience, right? And they get frustrated with all of us as a system. Why should I have to wait 3 months for a bed for my loved one? That's crazy, right? Right, and I agree, but that's why we advocate to make that process quicker, smoother for families.
Yeah, so this is just part, we can only do so much with Medicaid dollars, to Gary's point. The other thing I did want to mention, Gary, I know you said, you were talking about focused on the certified provider.
Right.
And it is required before you use PDGS that you use all other services. And so it can't only be about the fact that the provider wasn't certified. I just wanted to point that out. So for example, if you're going to get a technology device, we do have a service, assistive tech, and oftentimes families want to just go buy the iPad off of Amazon, but we do need to use the proper waiver service. That's a requirement of the federal program, is that you have to use the waiver service that's available. So I just wanted to mention that.
Yeah, there's lots of services, right? So you've got the AT rule, you've got the specialized medical equipment and supplies, and what we've known previously as adaptive and assistive equipment and all these things. So again, and remember, the waiver is the payer of last resort. I don't want to sound like a bad guy up here, but there are things that we spend a lot of time on, all of us, advocating for change, because again, it's about the continuity of care for that person. So stay focused on that. What are the needs of that person?
And your job as family, over there, if you don't talk, after a while, it goes dead. Hello?
And I just realized Becky recorded me saying that, didn't she?
So, and sometimes you'll find providers that can do both. So the Arc of Ohio provides assistive technology, but we often deal with GT independence as well. And so your job as a family is to identify the need. But under the self-waive and participant-directed goods and services, you can't convert a garage to a bedroom and have the system pay for it. You can't build a bathroom on the first floor because that changes the makeup of the house. You can't add an extra bedroom and increase the square footage. We have some crazy things in it. We have a lot of young families who have kids with cerebral palsy or spina bifida who are building a house. And they call and say, I want to make sure I build it correctly, so I would like the waiver to put in the bathroom for me to make sure it's okay. The waiver can't do that. But if you put in the bathroom, the waiver can rip it out and put in an accessible bathroom. Scott is my witness. So if you're there, don't buy expensive light fixtures and toilets for your bathroom, because the waiver can modify, but it can't just put it in there.